Today's webinar is about the heart. We did a heart video, which apparently got a lot of interest. And so this is a follow-up to that heart video. And just to say that the previous heart video was on the function of the heart, i.e. the heart is not a pump or a pressure propulsion device. And the second part of the book that I wrote, Human Heart, Cosmic Heart, the first part is about the heart is not a pump and how the blood moves around the body. And the second part is on what causes heart attacks. And so that's what today's webinar will be about. So I'm not going to go over the function of the heart. We've done that, and that was what that short video was about. So today's agenda webinar is what causes heart attacks, and what doesn't cause heart attacks, and what can you do about preventing and maybe even treating heart attacks. So I don't think there's any other announcements here. So I want to start with something that I've said many times, but some people may be new to this, which is just a brief explanation, maybe. I was going to use the word lesson, but that seems a bit arrogant, on scientific thinking, which I would also call it rational, logical thinking. And it's essentially the essence of what I'm going to first be doing. And that is science, as opposed to belief, is about falsifying claims. In other words, there's a claim made, a statement which is put out as true, and then in science, you get to attempt to falsify the claim. And if the claim is falsified, then it should be discarded. And if the claim can't be falsified, then it eventually becomes essentially something that we accept as being accurate and true. If the claim can't be falsified, like something like the world was created in 7 days, and I don't know whether that's true or not, and I don't know how to falsify it, that's what we would call a belief. And I have nothing against beliefs. We all have them, and we all use them in a way, and that's fine, but we shouldn't we need to be able to separate what is scientific, logical thinking versus what is basically belief. So inherent in this is science and logic and rational thinking is not about competing theories. And so you get to sort of somehow vote or decide on which theory you think is more accurate. That has nothing to do with it. In fact, you don't need to know what is true to know what isn't true. And the example that I've used many, many times is 18-year-old Asian fellow whose parents are Caucasian, and he always wondered about that, and he finds adoption papers in his parents' closet, and they got him from an orphanage in China, and that explains a lot and why he never saw pictures of his mother pregnant. So it's very clear he was adopted, goes to his best friend and says, just found out I was adopted. I'm a little shook up. And the friend says, so who are your real parents? And he says, I don't know. I just found out I was adopted from China. And the friend says, until you tell me who your real parents are, I don't believe you were adopted. And that's obviously, let's use the word nuts. Nobody would think like that because he may never know, and it has no bearing at all on whether he was adopted or not. So with that little introduction just to the process of thinking and the process of science, let's address what causes heart attacks. So like with everything, what we'd first do is find the claim. And with heart attacks, it's very simple because everybody knows this. Everybody from interventional cardiologists and normal cardiologists and normal medical doctors and family doctors and biologists and the people on the street and the people who went to college and the people who never went to college and probably most 10 to 15-year-old children know this. What causes heart attacks? so they may not know the details, but you got this heart. It's about a 1.1 pound organ, mostly muscle. And it has a blood supply of 3 main coronary arteries. Coronary artery means arteries that bring the blood to the heart. Probably a lot of people don't know there's 3, but there are. And if one or more of these arteries gets blocked with something, and usually we call this plaque, then the blood can't get through, and the part of the heart downstream from the blockage doesn't get the blood supply and the oxygen that it needs, and it can't get rid of waste products. And when that heart is under stress with exercise or emotion or something, then the blood supply deficit increases, and then you end up killing part of the heart, and that's what we call a heart attack. So in other words, the very clear and specific claim for what causes heart attacks is you get a blockage in one or more of the coronary arteries that inhibits the blood supply to the areas of the heart downstream from that, and then there's not enough oxygen, food, and elimination of waste products, and then you have a heart attack. And everybody agrees with that. Everybody, if you pick the next 10 people you see walking down the street, ask them what caused heart attack, whether they're cardiologists, internists, chiropractors, or just Joe Blow walking down the street, they'll all say the same thing. Now, there is, I would admit, and it's accurate to say, there are huge differences in the cause of the blockages. Some people say it's eating a vegan diet. Some people say it's eating too much fat. Some people say it's cholesterol. Some people say it's LDL cholesterol. Some people say it's inflammation. Some people say it's parasites. Some people say it's heavy metals. Some people say it's Lp(a). Some people say it's genetic. And people say all kinds of reasons why people think that we get plaque that clogs up our coronary arteries. Now, you will find very few people, and I guess you would say at this point I'm one of them, who say that the problem is the whole thing is wrong from the get-go, and it's not about arguing about why you get plaque. Does actually plaque build up, occluded coronary arteries cause heart attacks? That's what we're going to look at. Because if that's not the case, then it doesn't matter so much what causes the plaque to build up, because it's not the problem in the first place. Okay, so my story in this is, so I went to medical school and I was taught about the coronary artery theory, the stenosis theory, and this goes back to the 40s and 50s. I wasn't taught, interestingly, that the cardiologists in the 40s and 50s, when they started this coronary artery stenosis occlusion theory a lot of the cardiologists, in fact, I would say most of the cardiologists didn't agree with this. So I was never told that, but never mind. So then I went on and I finished medical school, a residency, started working as an ER doctor part-time to make money. And I saw lots of people with heart attacks, chest pain, suspected heart attacks, probably in the hundreds, maybe the thousands over the few years that I worked part-time in the ER. And I started to think about, is this thing really true that I had learned that it's all about coronary artery stenosis, blockage, plaque? So the first thing that I wondered about was, and I'll ask a series of questions, hopefully you can follow me. Is the blood in the body that's going through our arteries and veins and capillaries, is it the same everywhere in the body? And obviously the answer is yes. There isn't a special blood that goes to your heart and a different special blood that goes to your spleen and a different special blood that goes to your foot. There's basically one blood that circulates throughout your entire body. And as far as I know, there's nobody who disagrees with that. So the next question I asked myself was, are the arteries the same? In other words, if you dissected or looked at visually a coronary artery, a artery in the heart, is it the same as your splenic artery, the artery to your spleen, the femoral artery, the artery to your leg or foot, the hepatic artery, the artery to your liver, etc.? And again, as far as I know, all arteries are all made of the same thing. They're basically identical. In fact, you can graft them and change one for the other. Even you can do that with veins and arteries, and it still works. So if the blood is the same and the artery is the same, then it would follow that if the problem is there's too much of something in the blood, whether it's inflammation or cholesterol or LP little a or heavy metals or something, then it follows then that you would get similar plaque in every artery of the body. In other words, it wouldn't be the only place you get this plaque buildup would be coronary arteries, because if there's something too much like cholesterol, it would precipitate in the artery in your heart. It would precipitate in the artery in your spleen, in your liver, in your artery in your foot, etc. And in fact, to a certain extent, to a large extent, it does. And what we call this arterial sclerosis. And people who have arterial sclerosis affecting their coronary arteries most often have arterial sclerosis plaque buildup in all the arteries of their body, or at least many of them. And that, of course, makes sense, right? Because the same blood, same arteries should precipitate everywhere. So the next question I asked myself was, if this is a problem of plaque buildup, and you get plaque buildup in your splenic artery, which interestingly has only one artery instead of three like the heart, how come people don't have spleen attacks? And so I started asking pretty much every talk I gave on the heart and all the patients with heart problems, how many people do you know who've had a spleen attack? And I probably asked now 50 to 100,000 people. And one person raised their hand, and I think she didn't understand what I asked because I think she had to go to the bathroom. So nobody has ever seen a spleen attack, or a liver attack, or a foot attack, or a kidney attack. Now, you people will say, well, I've seen gallbladder attacks, but that's from stones in your common bile duct, and it has nothing to do with this ischemic blood flow issue that we're talking about. So it turns out the only two organs in the body that have these kind of ischemic blood flow attacks are the heart and the brain, which we call strokes. The heart we call a myocardial heart infarction. The brain, we call it a stroke. So why is that? That suggests that it's something different about the heart and the brain than all the other organs of the body. So that was the first clue, that something wasn't right with this coronary artery blockage hypothesis. So the next thing, once I wrote a book about the heart and what causes heart attacks, I started to get many, many patients who came to me with chest pain and wanted to know what to do about their heart. And I also saw many, many people when I worked in the ER. And many of them had the similar kind of story, which was they went walking up this hill like Mount Tam, where we used to live, or Mount Monadnock or somewhere with the wife. They were maybe 50-year-old man, and they started having a little chest pain, and they told the wife, and she got worried and said, you need to go to a cardiologist. They go to the cardiologist, and he goes, oh, it may be your heart. We got to do a workup. So they do a bunch of tests. And they come back and they usually wag their finger like this, and they say, oh, you have a 91% or so blockage in your left coronary artery, or your right coronary artery, or your left anterior descending, or in two of them. And if you block any more, this is where the finger wag comes in. you're going to have a heart attack. And so I asked myself the question, so you were just told, A, that all the blood flow to your heart goes through these three major arteries. B, you only have, say, 7 or 8% blood flow to a major area of your heart because it's 90, 91, 92% blocked. So my first question was, how did you walk up that hill? You got 3, 7, 8% blood flow to your heart. It would seem like that would be a serious deficit. And so you mean to tell me that if you block from 7% or 8% down to what, 4 or 5%, that that's going to kill you? And that made no sense to me. If you've got a 90% blockage and all the blood goes through that artery, you are in big trouble, and it doesn't matter if you block 2 or 3% more. So that got me really wondering about the whole thing. And so then I did something which you would expect that every doctor who has anything to do with hearts or heart attacks would have done early on in their career. But as far as I know, I'm the only one who's done this. Maybe others have. But I went looking in the medical literature, especially in these early days of this thrombogenic theory. That's what the plaque theory is called. And I looked with the question, how many people, what is the percentage of people who die of a heart attack who have a blockage in the artery leading to that part of the heart? Because I was told in medical school and training and all that, that is the only way you have a heart attack. So it should be 100%. If you have a part of your heart that dies, if you look at the blood artery leading to that heart, 100% should have plaque of significant amount, occluding the artery, stopping the blood flow, causing the heart attack. And interestingly, I found that this was a very hot topic back in the 40s, 50s, and maybe 60s before the cardiologists somehow settled on the cholesterol causes heart attack theory, and it's all about blocked arteries. And we're not going to get into why they did that, but there's reasons. And what I found was there were various studies, and the highest percentage of blocked arteries was 78%, and the lowest was 18%. And the best study that was ever done by an Italian pathologist named Giorgio Baroldi, and he wrote a book about this, the Etopathogenesis of Coronary Heart Disease. And he did autopsies on thousands of people who died of a heart attack. So these are the worst of the worst. And he said exactly 41% had any blockage of any significance to the area, to the artery leading to the part that had a heart attack. And he was sure that at least half of the blockages came after the heart attack, not before. So that means we're down to about 20% of the people who die of a heart attack, the worst of the worst, have a blockage. The other 80% didn't. Now, I would just say that does not mean that 20% even died because of a blockage. All we know is that they had a blockage before. It doesn't prove that that was the cause. And in fact, when you see this result that 80% of the people who died of a heart attack have no blockage at all, it makes you wonder whether the 20% had any significance at all. At that point, I was pretty convinced that this thrombogenic theory was basically a scam. But then I ran across this heart catheter film, and this one pretty much convinced me, and that's why I'm going to show it to you, that the whole thing is basically nonsense. So I'm going to show you this film. It's about 4 minutes, and hopefully this will put this thrombogenic theory to rest, and nobody will believe it from then on. So here's what the cardiologists usually show you. This is a picture of the heart, and here you see the 3 major coronary arteries with some of their branches. And I would just point out that this is not actually a photograph of the heart. This is somebody's drawing of the heart. And the reason that's important is because if they showed you the picture of the actual blood flow of the heart, you would have to put in thousands and thousands of small vessels, which are not shown here. And so this picture gets you to think that all the blood flow goes to the heart when we actually know that's not the case. And now I'm going to play the video, and hopefully that will show you what I mean.
Made during an angio. The right coronary artery at left hand will be filled with contrast medium using a heart catheter. Before we start the film, I want to show you the most important result of this examination in advance. You can see a severe narrowing, a stenosis, in the midsection of the artery. Now let us take a look at the angio. Let's watch the film again. I will now show you a series of photos taken from the angio so that you can study the procedure in detail. Here is the first photo. At the upper edge of the picture, you see the heart catheter with its curved end, still empty of contrast medium. Now the contrast medium starts to appear. You can see the roughly S-shaped form of the upper section of the artery, marked by contrast medium. This is the most intriguing photo. Why is this? The most important feature is the dark strip marked at the bottom left of the photo. This shows contrast medium in a section far beyond the stenosis. Nothing can yet be seen of the narrowing itself. Despite this, a section of the coronary artery far beyond the stenosis is already filling up. Here for the first time the stenosis, circled, appears. This is the same photo. The narrowing can be vaguely recognized due to the descending flow from above, but mainly as a result of the ascending flow from below. Things now become clearer. This stenosis hardly allows a single drop of blood to pass. The stenosis allows practically nothing to pass. It's not the case, as a layperson might assume, that the blood somehow manages to squeeze through the bottleneck and struggles to fill the lower part of the artery. Yet, it is exactly this section beyond the narrowing that is well filled. The blood must come from somewhere. Even if the collaterals, the vessels that make a detour around the stenosis, are not clearly seen, these photos are proof of their existence and effectivity. This is a perfect illustration of a 90% stenosis. However, this method fails to provide decisive information. It's not possible to show the extensive network of collaterals using the heart catheter. This leads to considerable false interpretations regarding the importance of coronary artery stenosis. In the very small narrowing, a little blood forces its way from above and a little from below. The blood in the stenosis is stagnant. If the narrow passageway is closed completely by a blood clot, a thrombosis, what happens then? Does a heart attack occur, as generally assumed? By no means. The blood is already standing still in the stenosis. A complete closure would have no effect. There is no alteration whatsoever. There can be no better illustration. The blood supply to the heart muscle beyond the stenosis is completely unaffected. The right coronary artery is clearly and powerfully displayed far to the regions of its finest branches. The stenosis does not damage the heart.
Okay, so hopefully that clarifies things, which means that the coronary angiogram is a radiographic artifact. And that's why the cardiologists love it, because of the way they do it and the dye and the heavy dye and the way they put it under pressure. It doesn't show the small blood vessels, the collateral vessels. And so it produces an artifact, even though you can clearly see, as he showed, that the blood supply is from these collateral vessels, and there is no effect from the blockage. That is not what causes heart attacks. And this then explained why coronary bypass surgery doesn't work. It explains why stents don't work. It explains why statin and anything to do with lowering your cholesterol doesn't work. And in fact, the stent story was very interesting because it's been known for years, if not decades, that stents and bypass surgery, which clears the blockage, so it should work, has never been shown to prevent further heart attacks. They've never been shown to lengthen people's lives. All they can say is that it stops the chest pain. That could also be from cutting the nerves. But there was a study in The Lancet in 2018. For the first time, they did half of the people in a study, they put a stent in an artery that people having chest pain, and the other half, they didn't put a stent in, but they put the catheter in, told them they put a stent in, but they didn't do anything. 6 to 8 weeks later, they had the same amount of chest pain. The New York Times, which therefore we know it must be true, ran headlines, "Stents Proven Useless," because then we knew that not only did they not prevent further heart attacks, they didn't lengthen your life, but they didn't even reduce chest pain. So I think at this point, I'm going to move on, because now we know that you were adopted and these aren't your real parents. We have falsified that claim. And even I would just point out that whether I get what causes heart attacks correct or not, it doesn't mean that that you have to go back to the blocked artery theory. That claim has been falsified, and so we're done with that. And so nobody needs to do anything based on their blockage. You don't need angiograms. You don't need calcium scores. You don't need any strategy to unblock the arteries, because that's not the problem. Okay, so at that point then, and this goes back at least 20 years, I was looking for some other way to help people with heart problems. And of course, there's diet and getting out in the sun and grounding to the earth and breathing good air and movement and emotional stability and good relations and all that. But I ended up running across a medicine which actually taught me, not only was it a medicine to help people with heart problems, and when I say heart problems, I'm mostly talking about the issues of chest pain, angina, congestive heart failure, atrial fibrillation, and then going on to have heart attacks. There are other kinds of heart problems, but that's not what I'm talking about. So it's often that finding a remedy for a certain situation goes a long way towards teaching you how that came about. And so, of course, that remedy is called strophanthus. And let's just have a little talk about what is strophanthus and what can it teach us about why people have heart problems. So I'm going to share my screen again here. Okay, strophanthus is the name of a plant. It's called Strophanthus gratus. It's native to Africa and I think Madagascar. It grows like a 300-foot vine or so, and it twirls around trees, and it makes pods sort of like cacao and coconut. And in the pods, it has hundreds, if not more, seeds, and it's the seeds of the Strophanthus pod that is used as a medicine. And it's been used for over a century by the native people. And interestingly, they called Strophanthus seeds as a medicine the gift from paradise. So that's what Strophanthus seeds are. Now, Strophanthus seeds, and I'm going to go through, this was from a study, and we could get you the reference for this. It may be in here, but I don't think I put it. No, that's the first one. Okay, so this is a reference, and this is from a very recent, like 2023 review article on wabein and cardiac glycosides. So what are cardiac glycosides? Cardiac glycosides are the chemical that's found in various plant and animal tissue. So there's a plant called digitalis, and it has a cardiac glycoside, which is a kind of chemical called digoxin, which is made into a medicine called lanoxin. And Strophanthus seeds have a chemical in it called wabein, Ouabain. And so that is the so-called active ingredient or chemical found in Strophanthus seeds. And as you can see, there's many more, and I'll show you these. These are used to treat atrial fibrillation, atrial flutter, congestive heart failure. And for many years, even decades, particularly in Europe and Germany, it was used to treat heart failure, angina, chest pain, and people who were at risk or having heart attacks. They even used IV Strophanthus extract to treat people who came into the hospital having a heart attack. Now, I'm going to go over what they say is the mechanism, and then I'm going to make some comments. They say the mechanism of all these cardiac glycosides is the same. They inhibit this enzyme called the sodium-potassium ATPase that's found in the cell membranes of all cells. And this regulates the distribution of sodium and potassium inside and outside the cell. And this is crucial because the distribution of sodium and potassium, first of all, if you inhibit it, you get more calcium inside the cell, which then makes the efficiency of the contraction better, which is called a positive inotropic effect, which is why it's used in so-called congestive heart failure. And more importantly, the sodium and potassium distribution creates the electrical charge of living tissues. And I'm going to go back to this. And they say here's a digoxin. It binds to this receptor on the cell membrane. And that's, they say, how it works. Let's see if I can go on. So here's the mechanism of action. I'm going to go through this very quickly. It binds to the sodium potassium, inhibits it. This is wabein, the Strophanthus active ingredient. And because of this binding, it gets the calcium to get into the cell, and that increases the contraction, makes it more efficient, increases the parasympathetic tone, and therefore everything gets better. Here's the article and the reference if anybody wants it. Cardiac glycosides from natural defense to emerging therapeutic agents in a journal called Biomolecules. This is May 2025, so it's even more recent. And you can read this if you want. And then they just say throughout history, various cardiac glycosides have been known from ancient Egypt. Oleander has one. Digitalis has one. Interestingly, the skin of toads and snakes have it, which may be the origin of the fairy tale story about kissing toads. And then here you see the different kind of cardiac glycosides and where they come from. So you see digitalis and oleander and Strophanthus gratis, which is wabein, and then you see the toads, and there's some other ones. And then you see a little schematic of how these cardiac glycosides work. So the yellow arrow means they make the heart function better. They make the nervous system function better. They kill imaginary viruses. They make your, quote, immune system work better. They inhibit cancer growth, and they nourish your skin. So these are all the possible ramifications of using cardiac glycosides, particularly wabein strophanthus extract. Their benefits which they've seen clinically. And here, no scientific paper these days would be complete without cartoons. So you can see a cartoon of the alleged sodium-potassium pump and how it all works. And I'm going to go through this really quickly. They talk about there may be even endogenous wabein, so we may have a similar chemical in us. So the strophanthus is sort of mimicking it, and it has to do with things like kidney dysfunction, high blood pressure, heart failure. It also has to do with regulating the sodium-potassium pump and regulating the charge across membranes. Here's other things that say these cardiac glycosides, particularly strophanthus, have an effect on stopping tumor progression, so they kill cancer cells. They help cancer patients survive longer. They reduce inflammation. They kill imaginary viruses, and they help all sorts of nervous system-related disorders, underscoring their broad therapeutic relevance. And here you can see the different cardiac glycosides, particularly strophanthus seed extract, wabein, on the various cancers: pancreatic, colorectal, liver, breast, lung, inhibits metastases, gets the cells to die, suppresses new blood vessel growth, and many, many more things. Even increases autophagy, which is supposedly the death of the cells. And they function as signaling, and so they're promising in cancer therapy and many other things. And here you see it induces apoptosis, death of the cells in cancer patients and in tumors. Here you see the effect on cardiovascular and cerebrovascular. So it helps people in heart failure. It helps people improve their cognitive performance. It helps stimulate the heart to function better, thereby preventing angina and going on to have heart attacks. They kill different viruses. And here's even that supposedly kills coronavirus. This is wabein. So here you see the conclusion. They're long regarded as cardiotonic, which means help the heart, but they have many, many other effects, and all centered around this sodium-potassium distribution. So the summary, it's a potent modulator, cancer, immune functions, and neurodegeneration. It gets rid of old cells. So everything to helping you not get sick, to preventing cancer, to preventing heart failure, helping with coronary heart disease, so-called, preventing Alzheimer's, dementia, and other neurodegenerative diseases. This is all in the literature as being related to these different cardiac glycosides, in particularly wabein. Okay. Now, the next thing I'm going to say is, even though I just read all that, basically all that is a bunch of scientific nonsense. And the reason I say that is because there is no sodium-potassium pump in the membrane. And so this cannot be, the effect is by inhibiting the sodium-potassium pump. And so every mechanism that they just went over, including gene function, apoptosis, immune modulation, and all the rest of it, is basically anti-scientific nonsense. But here is a very important point that I want to make, and I want to make sure everybody really hears this, so I may end up saying it twice. It's the question that I often ask people: the difference between what you see and what you think. In other words, they see people with heart failure, so-called. In other words, shortness of breath, fluid in their lungs, fluid in their legs. They get better when they take strophanthus extracts. They see people who have chest pain, and they get better when they take strophanthus seed extract. They see people who are in early stages of dementia or Parkinson's or other neurodegenerative diseases, and they get better when they take strophanthus seed extract. We see people who are getting sick all the time and having symptoms that are called the flu or RSV or COVID or any other kind of so-called viral infection. And we see them not getting sick and being stronger and healthier. We see people who have breast cancer, lung cancer, pancreatic cancer, colorectal cancer, who take strophanthus seed extract, and they live longer, feel better, are healthier. These are all accurate observations. I'm going to say that again. These are accurate observations of what happens to people who take strophanthus seed extract. The mechanism is complete nonsense. But just because the mechanism is wrong doesn't mean the person with dementia didn't get better. That is the distinction I want to make. Just because I'm saying the mechanism of apoptosis and sodium-potassium pump inhibition is wrong doesn't mean they didn't get better. They did. That was an accurate observation. So first of all, why am I saying there is no sodium-potassium pump? And this came from the thesis of Gilbert Ling, one of the best biologists ever. So allegedly, here's the claim, there is this, you see an unequal distribution of sodium and potassium inside and outside of tissues or cells. That is an observation. And that creates a charge, which is essentially what life is. Life is charged tissue. That's why we measure EEGs and EKGs and EMGs. If there's no electrical charge, then there's no life. So in order to have this charge, it comes about because an unequal distribution of sodium and potassium. Now, Gilbert Ling measured the sodium and potassium inside and outside, and it's clearly different. So this couldn't be just simple diffusion across a membrane. And so that's why they allege there must be a pump. And he did a brilliant thing, which is he stripped the membrane, the outer layer, off the cells, remeasured the sodium and potassium, and found it was exactly the same. Let me say that again. If the distribution of sodium and potassium, which creates the charge, which makes your brain work, which makes your heart work, which makes your muscles work, which is the reason you don't get sick and the reason you feel good. This is because your battery is charged. And this is because, to a large extent, of the distribution of sodium potassium. He stripped the membrane off, and the sodium potassium and the charge was identical. This proves that it has not only nothing to do with the pump, it has nothing to do with the cell membrane. And then he went on to show that the reason for this distribution is the inside of tissues and cells is a very specific gel layer, which, because of the sort of mesh quality of the gel, holds on to potassium and excludes sodium, no energy needed. And as long as you have a perfect crystalline gel, you will hang on to the potassium, exclude the sodium, create a difference. That difference creates the charge, and then your battery is full, and everything in your life, your heart function, brain function, whether you get sick, whether you get cancer, all that improves because your water structure is normal. And that leads to the conclusion of, what does strophanthus seed extract do? It's somehow, in probably all the tissues of the body, but more even maybe specifically for the heart, it improves the crystalline nature of the water. It is truly the gift from paradise because the crystalline, perfect nature of water is essentially the essence of the definition of health. Somehow, this extract from this plant is able to give a blueprint to the body to make the crystalline structure the way it should be for you and for that organ. That excludes the sodium, hangs on to the potassium. You get the proper charge. And in the heart, we know, and this gets into the things we talked to, what does the heart do? Therefore, the heart can create this 6-foot toroidal electromagnetic field, which is basically the essence of a healthy heart. When the charge becomes weak, the field contracts, and that starts to cause the experience of pain, and the metabolism starts to become acidic, and you start to build up lactic acid in the tissues, just like your muscles, and then you get cramps, just like your muscles, except your legs can stop, and your heart and brain can't. And so they keep going with this altered, constricted metabolism, and that goes on to actually destroy the tissue, which is what we call a heart attack and a stroke. The reason that doesn't happen in the spleen and the liver and the foot and the kidneys is those organs need and use far less energy. They create a far weaker electromagnetic field. You should think of this toroidal 6-foot field. By the way, that was the reason they wanted people 6 feet apart, not because of any, quote, virus, but they wanted people to be isolated from each other so their heart fields wouldn't interact. We need to be within each other's heart field. You can feel the heart field. That's the electromagnetic toroidal field. And that comes because of the crystalline nature of the water in the heart tissues, which works through these ions to create this robust electromagnetic field. And when that happens, your heart functions better, so your circulation is better. That's congestive heart failure. Your rhythm is better. That's atrial fibrillation and flutter. And you don't go on to have chest pain and heart attacks. That's angina and heart attacks. It also prevents strokes. And since this same loss of electromagnetic field happens in cancer, that is also less too. And so at the end of the day, you can see why native people called strophanthus seed extract the gift from paradise, because I don't know any other plant medicine that has such a widespread and powerful effect. So that's the sorts of theory or my explanation of what it is. So let's now finish. We have 10 more minutes, and I know there's a lot of questions, so maybe I'll take a little more time. So how do you use it, and what is it? So first of all, I want to say that we actually are the sole U.S. distributor of properly made strophanthus seed extracts, and these are distributed and sold at our drtomcowan.com website. If you use the code HEART, which is HEART, see, I know how to spell heart, all capital letters, we will give you a discount on strophanthus. So our strophanthus seed extract, and the only strophanthus seed extract that has been shown to have all these properties, is made from properly sourced seeds. They're collected by native people. They extract the seeds. They either grind the seeds, that's our powder, or they extract them with soaking it in alcohol for a month or so, and that's our strophanthus seed liquid extract. They both can contain the active ingredient wabein. We've had that checked. So we know it's the right plant, it's the right seed, and all of the truly positive studies have not been done with chemical wabein, but with strophanthus seeds, either ground or extracted. So you get the entirety of the seed and not just the so-called active ingredient or chemicals. We are not chemicals. This is an interaction with the seed and the human being. And it only works properly if you have the whole seed extract, either just as a powder or as a liquid extract. There are literally no contraindications, except generally speaking, we don't give it with another cardiac glycoside like digoxin, even though, interestingly, the one study I did read about this showed that if you give strophanthus seed extract with digoxin, it lowers the toxicity of digoxin. But I would be cautious, especially on your own, using that. The wabein is water soluble as opposed to digoxin, which is fat soluble. Therefore, it's short acting and doesn't build up. So because of that, it has far less toxicity. In Germany, they say it's as toxic as a cup of coffee, and I'm not even sure it's that toxic. And in my 20 years of using it, I can't say that I've ever seen anybody who had any sort of toxic reaction to our properly made strophanthus seed extract. It can be used with any other drugs or herbs that I know of, again, with the possible exception of digoxin. It should be given 3 times a day, whether you use the capsules or the powder, because, like I say, it's short acting, which means it has a short effect, and then your body excretes it. And the dose is with the capsules, it's best to open the capsules and put the powder under your tongue for about a minute and let it absorb sublingually. And you do start with usually 1 capsule 2 or 3 times a day, and then see how you feel. And the maximum dose is 2-3 times a day. But most people feel relief. They feel they're calmer, their parasympathetic nervous system is better. Their chest pain is better. We've been able to document improvement in ejection fractions, which means the efficiency of their heart is better. You might notice that your thinking is more clear and you're getting sick less often. And whatever dose that starts to happen, that's where you stay. With the liquid drops, usually you start with, say, 5 to 7, maybe 10 drops if you're a big man, 3 times a day. You put those directly in your mouth. Again, let them sit under your tongue for about a minute. And then you can slowly work up to 20 to 30 drops 3 times a day. Again, directly in your mouth, 3 times a day, noticing the effect. And as soon as you see any positive effect, just stay at that dose and keep it at that dose until that positive effect seems to wear off, which may never happen. And I've had patients who've been taking it for 20 years, and that's the reason why they've never had a recurrence of their angina. Their congestive heart failure has been better. We have many, many testimonials and stories, and it truly was the most impactful medicine that I probably have ever used in my career. And that's why I have dedicated a large part of my speaking to trying to make sure that the proper form of strophanthus, it has to be the genuine strophanthus. It has to be an extract or a powder from the whole seed. It has to have this active ingredient, wabein. It has to be given in the right way, which is sublingually under the tongue, usually 3 times a day at whatever dose works. And this has been an incredible boon to the people in my practice and the people that we've worked with in the clinic. And again, we're having a sale on the strophanthus extract and powder, and that's at the drtomcowan.com website, and use the heart code, all capital letters. Okay, I think that's it. And so I was planning to go for an hour, but I have 30 questions, and I don't think I'm going to get to all 30. But I'm going to just take a look at the questions and see what I can find. So can you use strophanthus with pets? I don't know. And I would be cautious about that just because there are certain medicines, certain plants which do well in people and don't do well in animals. And I actually have no idea whether anybody has used Strophanthus with any sort of animal. So I don't want to be the first to say that. Maybe somebody from Germany, they might know because that's really the epicenter of the use of Strophanthus. So can you take the capsules of Strophanthus if you think you're having a heart attack or stroke? And the answer to that is absolutely yes. And I would take, whether you have the capsules or the liquid, I would take one capsule every half an hour or 20 to 30 drops every half an hour. And you may or may not have to go to the hospital, but that is whether or not you go to the hospital, I would still do that. And over the years, and I wouldn't necessarily recommend this, but I had maybe 4 or 5, maybe 6 patients who had had heart attacks. And I still contend, by the way, of all the hundreds and maybe more people that I've seen who came to me after having a heart attack, I don't remember one person who took Strophanthus properly who went on to have another heart attack. I know there was somebody on some Amazon site that said they did, and I never got to question them what they were doing. And I'm sure it could happen, and I'm sure it has happened, but I had never seen that. And so I had at least 4 or 5 patients through the years who'd had heart attacks. They were elderly, often they lived alone, and they had exactly the same symptoms as they had when they were had their previous heart attack or heart attacks. And so they called me up saying they have the same symptoms. And I would typically say, well, you got to go to the hospital, but take Strophanthus in the meantime. And they would say to me, I don't care what you say, I'm not going to the hospital. If I die, I die, but I'm not going to the hospital. So tell me what to do. And I would tell them to take Strophanthus seed extract like I just described every half an hour for 2 hours and then call me back. And it's not a big sample, but all 5 or 6, the pain went away. The scenario seemed to stop, and they seemed to go on and be fairly normal after that. I don't remember ever having done that with somebody who I thought was having a stroke. And I would acknowledge that because I didn't do an EKG and I didn't even see them and I didn't even have a blood pressure, I didn't see any of those people. I didn't do any blood tests. I didn't do any EKG. So it is absolutely true that I don't know whether they were having a heart attack, but it sure seemed like it from what they said. And I'm not saying that is a strategy for everybody to do, but I did see it work. Is Strophanthus helpful for hypertrophic cardiomyopathy or not? And left ventricular, I think that's outflow tract. So Strophanthus is not an anti-arrhythmic, meaning if you have like SVT or some purely rhythm problem, it probably won't help with that. On the other hand, atrial fibrillation is an energy metabolic problem, and it is not going to convert somebody from AFib into normal sinus rhythm acutely. But what it will do is lessen the incidence and severity of the AFib or aflutter episodes, because both of those are a poisoning, essentially an energetic contraction of the heart, and that's why the heart sends out abnormal signals, and that will be all lessened with using Strophanthus. And I have a number of patients who confirm that, but that's different than being an antiarrhythmic. It also is not indicated for valvular problems, like if you have a stenosed aortic valve or regurgitation of your mitral valve, it will not fix that. It will, however, keep your heart functioning at a more efficient and optimal way. And so you'll have fewer repercussions from that valvular disease. That's different than saying it will somehow heal or do something positive to the actual valve. That I've never seen. And by the way, that gets into, people often ask me, even though we go through the coronary artery plaque thing, does it help reduce the plaque? And I would say no. There's no evidence that giving somebody strophanthus extract lowers their cholesterol, lowers their LP(a), or chelates heavy metals, reduces inflammation, or any of the other things that supposedly cause the plaque. My personal feeling of, or thinking about plaque is your body is seeing that there's weakened blood vessel walls, because blood vessel walls should have a gel layer of water, structured water, essentially protecting the inner lining of the vessel. And that happens because of the energetics and because of earthing and sunlight exposure and minerals. And if all that is weak, so that shouldn't be weak, you should get out in the sun and ground to the earth and eat clean food and drink clean water and take good minerals. But if that's weak, you have a weakened wall, and the last thing the body wants is to rupture the vessel, because that could be curtains. So it puts a kind of cement, which we call plaque, to shore up the vessel. In other words, the plaque is the therapy for a weakened wall. So at least it doesn't burst. Now, it may restrict the blood flow, but we already know that 90+% of the blood flow is not through those arteries anyway, so that's a sort of minor inconvenience. But strophanthus does not get rid of the plaque. At least that's what I told people. And then I had a bunch of people through the years who, not because I told them to, but I said NSAC not to, would do coronary calcium scores and say they have 60% blockage or 80%, and then they would take strophanthus for 6 months and maybe not do anything else different, and the calcium score would reduce, and they would say, see, it reduced my plaque. I would have to admit that that seems to be what happened, and I think it's just because if it helped with the water, then you probably had better protection of the vessels, and your body could get rid of the plaque because it doesn't need it anymore, and it is an annoyance restricting some flow at least. But that's different than actually directly getting rid of the plaque. Okay, how is it can have such an amazing results in a few weeks? Sometimes it's only a few days. Why? Because it seems to restructure your water, and then your battery gets recharged, and then you go on with your life. Do you recommend taking it with Shilajit or on its own? For everything I said was basically on its own, and whether you need to take other things like Shilajit, certainly good stuff, that's a different question. For those who have stents, can they still benefit from strophanthus? The answer is yes. And it was very common for me to see people coming in after failed stents. In other words, they had chest pain and they had, problems with exertion, and they had a stent and it didn't do them any good, which is what the research says. And so they had stents, and then they took strophanthus and it still helped. The problem with doing a stent or a bypass is that it's a bit like if you have a bunch of county roads and then you have a central highway. So you think of the central highway as the main coronary artery. And if you keep the county roads in good shape, then if you get a blockage or a crash on the central highway, the cars can still go around and the flow is still good. But if you say, we're going to put all our eggs in the basket of the central highway, and we're going to degrade the auxiliary, the other roads, and essentially just focus on the central highway, which is what happens with a stent, you essentially degrade the other auxiliary capillaries. Then if the stent blocks up again, which it will, then you have a problem because you've put all your eggs in one basket. So that's the detrimental effect of having a stent or a bypass. It's, however, good for business because this is probably a $50 billion a year business of putting stents in, and then they get blocked up, and then you have to take drugs to keep them from blocking up, and the drugs cause you problems and make them block up even more. And so it's a bit of a nightmare. So I would avoid that if at all possible. The homeopathic strophanthus, I have used a little bit. It's not the same, and all these effects that I'm talking about have never been shown with homeopathic strophanthus or any of the other ones they sell on Amazon. They're not pure strophanthus seed extracts that have been shown to have this active ingredient and shown through decades of use and recent studies to have the therapeutic effect I'm talking about. So I don't recommend using homeopathic strophanthus or any of the other sort of knockoffs that are being sold. That doesn't mean I have anything against homeopathy, but it's not homeopathic strophanthus that's the key here. We need a genuine strophanthus seed extract, either the powder or the liquid. So somebody said, I recommend it for everybody over 50. The dose is basically the same, although if you're basically fine and just want to take it preventatively, you can take it maybe once or twice a day, 7 to 10 drops, or one capsule once or twice a day. And to be fair, in my practice, I didn't give it to everybody over 50. Also, to be fair, I started taking it about 20 some years ago when I was around 50. And partly because some people had said, oh, strophanthus arrow poison is going to kill you. So I wanted to see if it would in fact kill me. So I'd pretty much taken it almost every day, if not 99% of the days for the last 20 years. And I can definitely report that it didn't kill me. So that's good. The guy I learned strophanthus, how to use it, etc., absolutely said you should give it to everybody over 50. It helps prevent aging or neurodegeneration, helps them not get cancer. And I didn't have the evidence to do that. I would say, given this research that I showed, we actually do have the evidence that it does do that. It prevents degeneration of your thinking and neurodegenerative diseases, and certainly the development of certain cancers and the development of heart problems, keeps you from getting sick. So I may have to rethink that, not that I treat patients anymore, but I have nothing against everybody over 50 giving it a try and at least seeing if they see any difference in how they feel. So somebody asked, why do people get relief, not everybody, from stents and catheterization? And all I can say is this study that was in the Lancet, which I probably could find, but somebody should be able to find it. I think it was 2018 on the first double-blind, well, wasn't double-blind, it was single-blind use of stents. And so there apparently was a strong placebo effect. In other words, they put the catheter in, they told them they put a stent in, but didn't, and they had exact same amount of pain. I think that bypass surgery works to a certain extent, works meaning stops the pain, because they cut the nerve fibers. And so that's a clever way of stopping pain. If you if you have pain down your leg, if you cut all the nerves to your leg, you will stop having pain. And that's like if your check engine light comes on, we all know the thing to do is to bash the dashboard with a sledgehammer, and that is 100% fix for stopping the check engine light coming on. You may not make it home, but that's different. The downside of a stent is that it degrades because you've now shunted the blood from the small vessels, which because of a blockage, you get a more robust small vessel development. When you reopen that blocked artery, you shunt the blood back through there. That causes the capillary, the collateral blood flow to collapse, and you don't have unlimited room to make more and more capillaries, and so you end up with a compromised circulation as a result of the stent. Both Strophanthus liquid and extract, liquid and capsules, help high blood pressure just because they help the formation of the water, which has a lot to do with the blood flow. There is the question about if you have abnormal electrolytes like low sodium, high potassium. That is one thing that Strophanthus doctors pay attention to. People with serious electrolyte imbalances, you may want to correct that before you give Strophanthus. I must admit, I didn't routinely check electrolytes, sodium, potassium, but it's not a bad idea. I think I'm going to do a few more here. How do you know how much to take? You try to just tune in to what was the reason I took it. Is it my thinking is not like it used to be? Is it my endurance? Is it my sleep, my erectile function, whatever it is that's not right? And you slowly go up until you find a dose that might help. And the maximum dose is, say, 20 to 30 drops or 2 capsules 3 times a day. And that's how you find the dose. Can you take Strophanthus if you were accidentally ingested digitalis? It's interesting. I would say yes, as long as you're still not taking digitalis. Do I recommend Strophanthus for everyone who has cardiovascular or cognitive issues? The answer is yes. What about low salt diets or no salt? That's not a good way to go. Don't do that. It helps with AFib not directly. It is not an antiarrhythmic, but it helps the metabolism, so you will get less AFib. Strophanthus and hibiscus are totally different. Hibiscus extract is for nourishing the veins in particular, so like varicose veins and phlebitis, and to a certain extent congestive heart failure to make the blood go back up to the heart. But it's not at all the same as Strophanthus. Yeah, I'm going to stick to heart issues. Faulty heart valves is a whole different issue, which I don't think I can address. What about tapering off beta blockers? That is an issue, and that's something you should work with one of our primary wellness specialists. Unlike statins, I used to say the only good thing about statins is you can stop them from one day to the next. Beta blockers, you can't, because you will have usually very high blood pressure and rhythm problems, and you don't want to do that. You can definitely take it as a preventative. That's most people use. The homeopathic I talked about. I think that's pretty much it. Okay. So thanks everybody for listening. I hope you have a good sense of issues around heart attacks and Strophanthus, and I really appreciate all the support.